Hi, everyone. I'm Alana. I'm a massage therapist in Cochrane, Alberta. And this is an attempt at a summary of my vagus nerve health presentation. I'm going to try and do this in 10 minutes, which I'm not sure I've ever done before. But everything we're going to do is going to be a summary. When we talk about the nervous system, massive structure that goes throughout the whole body. It's not just the brain or just the brain and spinal cord, but we're also talking about our enteric nervous system in our gut. All the ingoing and outgoing nerves and all the nervous system structures that interact with the system. It's extremely connected to our immune system and our endocrine system. Those are hard to separate. And it is divided into our autonomic, or the nervous system that's below our conscious control, and our somatic nervous system, which is in our conscious control. The somatic system is the one that allows us to make major muscle movements, for example. We are really talking only about our autonomic nervous system today. I hear a lot out there about nervous system regulation, and I think it's really important to discuss. When I discuss it, and I hope this is the theme that we're picking up when we hear people discuss nervous system regulation, is really that we're talking about the ability of the nervous system to switch from a relaxed state to a stressed state and back again to a relaxed state. I don't want to send the message that a stressed response or a stressed nervous system being in our sympathetic drive is bad or wrong. It's not. It's very healthy. It's essential, but we have to be able to then switch back again to our parasympathetic system, which is where a lot of us have some trouble getting back to. Neuroplasticity is the brain's ability to adapt its structures or functions in response to stimulus. And that's an important concept to know, that we do not lose that ability as we age. Well, we lose some of it, but we don't lose all of it. We are able to train our nervous system right up until the point of death. So we are hoping that we can get into our stress response and back into our relaxed response appropriately according to the stimulus that's happening around us. When we look at the autonomic nervous system, this is the automatic control, functions below our conscious control. It does homeostasis. And we should be able to switch back and forth readily. If we can't, then we end up with symptoms of autonomic dysregulation. So in our sympathetic nervous system, or our stress response, this is what allows us to respond to those stressors, to perform, to exercise. If we're playing sports, we're likely in our sympathetic system. It allows us to work hard to meet goals. Again, it's healthy, it's essential, it's necessary. It raises our heart rate, our breathing rate, and primarily sends blood to our major muscles instead of to our brain and our digestive system. It's very fast, and it is automatic. Our parasympathetic system, this is our relaxed or our resting response. This allows us to relax, digest food, recover, repair, recover from injury. This is where we use our executive function. This is where we connect socially and we feel safe. It slows our heart rate and our breathing. It sends blood to our brain and our digestive system. It is also fast and automatic, but it is not nearly as fast as our stress response is. When we get dysregulation in our nervous system, we really just mean that we're not very good at switching back and forth readily. Most of us end up spending a lot more time in our stress response and become not very good at coming back to our relaxation response. Our nervous system really is adapted to stressors that are direct, discrete, right? They have a beginning and an end to them, and they're very identifiable. We don't really have stressors like that in our lives a lot anymore. They're vague, they're overlapping. Maybe they never really seem to end because we're always exposed to those stressors. Or possibly we live with nervous system conditions like depression, ADHD, trauma, anxiety, just a really high stress load, a lot of overwhelm. For a lot of reasons, the nervous system may become stuck in our stress response, and we just can't get back to our relaxation response. Or not that we can't do it, but we don't do it as automatically as we should, and we don't do it nearly as frequently as we should. The other thing that affects this is that our nervous system's main job is to keep us safe. So incoming information from the outside world is always going to be prioritized over information from the inside of our bodies, because that's where our threats come from. And this plays into the workings of our nervous system. Okay, so nervous system's main job is to keep us safe. When we're faced with a stressor, this might present with us going into a fight or flight response, or it might present for some of us more as a freeze or a shutdown response. Both of these can be seen as ways to protect us. If we are in that frozen or shut down state, we are less likely to expose ourselves to stressors. So a freeze or shutdown might look like a severe lack of motivation, feeling like we can't get out of bed or can't face our day. It might present in our body as chronic pain. Anything that prevents us from going out and engaging in the world and facing those stressors is a nervous system response and can be seen as a way of our brains to try and protect us. Same thing with fight or flight. If we tend to be a little bit more elevated, also that is our nervous system trying to prepare us to run away from or to fight back against a stressor. If we then go on to talk about our vagus nerve. So the vagus nerve is a massive cranial nerve. It leaves the brainstem, so it's very low in the brain, and it travels through the throat, the thorax, or the chest, and the abdomen. It has three main roles: our mind-body connection, or what we call interoception, or perception of our interior selves, our gut-brain axis, and our relaxation response. It's what turns on that parasympathetic system. So 80% of its work is incoming information. So it is the basis of our interoception. It does things as basic as hunger and thirst and motivation and blood pressure control and heart rate, breathing rate. It deals with a lot of essential functions. Deals with a bunch of structures that you can see here: swallowing or vocal cords, the esophagus and trachea, so passage of air and food and water in and out of the body. It deals with our heart and our lungs, the center of our diaphragm, our stomach, our full gut, so all our intestine, and all the critical organs, and our endocrine, so our hormone-producing glands that are in the abdomen, our lymphatic system, and our circulatory vessels. It's dealing with a lot of really essential functions. It is the full gut-brain axis, so all information traveling between the gut and brain travels via the vagus nerve. So it deals with gut motility, stomach acid composition, and how much we have, digestion. It deals with emotions that we consider gut-based emotions like anger, anxiety, sadness, elation, passion. It maintains the gut microbiota and really is very involved in our immune response and our inflammatory response. The vagus nerve is what begins and controls the inflammatory response in the body. And then it is what turns on our parasympathetic nervous system, our relaxed state. So theoretically, after a stressor, during sleep, when we're at rest, the vagus nerve should turn on the rest and recovery mode. It works in conjunction with and in opposition to our sympathetic chain. So when we're stressed, that sympathetic chain fires up and puts us in our stress response. After that, we should come into our relaxed state. It should allow for safety. A friend of mine calls this state calm aliveness, which I really like the impression that leaves with us. It allows us to connect with others, do our executive function, repair and recover, and do our functions of digestion. It has a few nerves that it's very connected to. So, excuse me, the trigeminal nerve, which is involved in the muscles of chewing and all of the sensory input from the face, the scalp, and the jaw. It's also involved with our sinuses. The spinal accessory nerve does two main muscles in the neck. So it really controls this neck and shoulder tension that a lot of us have chronically. The facial nerve is part of this little group of connected nerves, and it does all of our muscles of facial expression. And then we also have our hypoglossal nerve, which does tongue and swallowing movements. All of the external information coming in from our senses, vision, hearing, touch, taste, all of that information is coming into the same area in the brain where the vagus nerve is processing its information. So because of that prioritization to outside threats or outside information, we can end up ignoring our vagus nerve or the information that's coming in. And we're doing that because there's some kind of overstimulating, stressful, or confusing stimulus coming in from our outside environment. So dysfunction, when we get dysfunction in the vagus nerve, which can happen for a variety of reasons, this is also the same grouping, the same symptoms, the same issues as autonomic nervous system dysregulation, or the other term that gets used for this is dysautonomia. So these are all symptoms that are common. There are others, but these are the big ones. So any inflammatory gut conditions, IBS, ulcerative colitis, Crohn's, heart rate irregularities, headache and migraine are very common, along with chronic neck and shoulder pain and tension, sinus congestion, throat congestion, chronic unexplained pain or chronic pain conditions. So the vagus nerve is involved in our understanding of pain in the body. And when it's not functioning well, we can get misclassified pain. We can get breathing difficulties, mood disorder like anxiety, depression, definitely go along with nervous system dysregulation. We can get brain fog and memory problems, internal organ dysfunction, acid reflux, tinnitus or ringing in the ears, and also vertigo. These conditions are complex. There's a lot of different factors that can cause these types of conditions. So vagus nerve dysfunction is not the only thing that causes these, and dealing with the dysfunction is not necessarily always the solution for these symptoms. But most of the time when we deal with the nervous system dysregulation, we see an improvement in the symptoms listed here as well as others, even if they're being caused by something that is in addition to this vagus nerve dysfunction. There's a lot of research going into vagus nerve stimulation right now. It's quite an exciting area of science. It still is definitely on the fringes. We're not seeing a lot of vagus nerve stimulation coming up in healthcare, but it is becoming more known and more popular and more used. There are some electrical stimulation devices which are implanted much like a pacemaker. And those devices are primarily used to treat treatment-resistant depression and medication-resistant epilepsy, some headaches, and also in stroke recovery and concussion recovery. But there are other ways to stimulate the vagus nerve. Most of the research is being done on electrical stimulation, which is done through the skin with a device similar to a TENS machine, like what you might get at a physio clinic, or the Dr. Ho machine that a lot of people have. That's electrical input through the skin into the nervous system or muscles, depending on what's being targeted. So lots of research ongoing, very current. A lot of the studies that I'm reading are published in 2022, 2023, or they're actually just recruiting subjects for them right now. So all of these conditions listed here, plus way more, have ongoing studies. So cancer recovery, stroke and TBI, or traumatic brain injury recovery and concussion, fibromyalgia, also chronic fatigue and Lyme disease have some research going into them. Headache and migraine, long COVID, both of those have devices that have been approved by Health Canada or the FDA and are purchasable on the market, and getting some really, really good results. Rheumatoid arthritis, chronic pain conditions, inflammatory gut conditions, PTSD, type 2 diabetes, also things like age-related cognitive decline and Alzheimer's and dementia. Really, almost anything I look up, if it has to do with any of the structures that are dealt with by the vagus nerve, there's a research study going on in how stimulation can affect symptoms. So fortunately, there are many ways to stimulate the vagus nerve, not just electrical stimulation. There will be a separate video with specific self-care demonstrated here. I'll demonstrate the breath work I like with the physiological sigh. I'll demonstrate the vagus nerve basic exercise and some self-massage. But other things that are great for the vagus nerve, cold water immersion, or this is, the function of our mammalian dive reflex. You do not have to be fully immersed in cold water, though, to get the benefits, which is great news for a lot of us. Cold water to the face is very effective, especially if you're doing cold water to the face and a breath hold at the same time. So if you keep a cold washcloth in your fridge, for example, and apply that washcloth to your eyes while you hold your breath for as long as it's comfortable for you, that can be a really great stimulation to the vagus nerve. Anytime we're connecting with loved ones, people we feel safe with, we get the co-regulation of someone else's calm nervous system, helping to calm our nervous system. Mild exercise, anything we can combine exercise with breathing. So going for a walk, yoga, Pilates, any kind of Tai Chi is really, really good for this as well. So any kind of exercise where you stay in your relaxed nervous system is great for this. Singing, gargling, and humming are stimulating because the vagus nerve deals with our vocal cords. And then we've got our transcutaneous or through the stim electrical stimulation. So the type of outcomes I see in my practice, conditions are very complex. There's symptoms that overlap and they can be based on a lot of different factors. So I don't mean to imply that these little exercises are going to be the solution to everything that's wrong with us. Though I have seen really positive changes for clients. And for a lot of clients, it's where other things have failed. We can't get really good results with massage, or maybe they get results and they're temporary. They've tried lots of different treatments. Maybe they've tried lots of different medications. And a lot of times, in my opinion, we're not getting success with a lot of these interventions because they don't feel safe to our nervous system yet, or our nervous system just goes back to its dysregulated state. So I have seen changes either in myself or for clients in the following things. So chronic headache and migraine, definitely. IBS and other undiagnosed digestive complications, facial pain and swelling, tinnitus, long COVID, depression and anxiety, and ADHD. I have ADHD and I use these techniques myself to keep my stress levels much more level. And I found a huge benefit to my ADHD symptoms while I'm doing this work. I do also take medication and get counseling, but the vagus work has allowed me to take less medication and feel a lot more stable in my nervous system. The consistency of this is what's difficult. So all of the self-care that I describe and all of the treatment that I do in my practice is very simple, but self-care is never easy because it is really the consistency which makes it effective. Our nervous system just loves consistency. The things we do the most become easier and smoother neural pathways. Things that we don't do very often, we can't access very easily. So getting to this work daily or a couple of times or even more every day makes it very effective. It can be slow to see change. Some people see benefit almost immediately with vagus nerve work. Other people, in a lot of the studies, it's more around the 10 or 12 week mark that they start seeing the benefit. And I've seen that happens with clients as well. Some people just right away notice benefit. Other people, it takes them a while. They're finding some benefit, but they don't really see consistent change until they have done it for a couple of months, which again, makes it difficult to do something regularly when you're not seeing a ton of benefit from it right away. Contact info for me if you're interested in talking about more vagus nerve work. If you have questions, also please feel free to see the longer presentation. There's a lot more detail in the things that we've discussed here. But please feel free to send me an email or follow me on social media. If you need nervous system regulation work done for you, that's what I do a lot of in my practice. So this is physical ways to interact with the nervous system. It's not, there's no counseling or mental health work done in my practice. And I found that it is really effective for symptom management for a lot of conditions, especially when it's part of a package of work that you're getting done with other people as well. So please feel free to get in touch with questions. And I look forward to hearing from you. I hope this was a good rundown. I hope that you find some of it effective, and please check out the self-care video as well. Okay, take care.